Okay, as I am filming this, we are 10 days away from surgery. I just had my pre-op appointment, and I am nervous because I'm used to taking the estrogen pill for all my hormones, but now they're switching me to a patch after surgery. I'm sure I'm going to get used to it. It's going to be the rest of my life kind of thing, you know, until I'm of the correct age for menopause. I'm still going to have menopause right after surgery. It's just to help slow it down a little bit, I guess. I don't know if I'm saying that all correctly, but that's what I got from the appointment. I don't know how I feel about the patch. I would rather just, I already have a lot of medications that I have to take for other health issues, so I would rather it just be a pill, but the doctor wants to try a patch, so we're gonna do that. It's like an orange bag, and it has like a wipe down medicated cloth or whatever. So the night before surgery, I have to take a shower, wipe myself down. The next morning, wipe myself down again. I have to drink this at 6:30 in the morning. Everybody's telling me to get it cold, put it in the fridge, because otherwise it's kind of gross. The doctor told me I did not have to sleep in a recliner, but because our bed is on the ground, she recommends it, so I probably will be doing that. They're going to put a hole in my belly button, and then kind of like they did on the laparoscopy, one on each side of my belly button on my stomach, kind of closer to my hip area. They already filled my medications so that when I come home from surgery, it's already here. No lifting anything over 15 pounds for 6 to 8 weeks, so I will have to have family feed my horses for quite a while. They said there's a lot that can go wrong. It can damage my bladder, my kidneys, the tube from my kidney to whatever. So pretty much, if they have any of those types of issues, they'll go in another surgery and do a laparoscopy and fix it. She said is depending on how bad the endometriosis is that they find in other areas, if they find any, is they may or may not be able to remove it right then. It depends on heart rate, oxygen levels, how my body is doing well under anesthesia. So it will be a complete full hysterectomy, both tubes, both ovaries, cervix, and uterus. I also have IC, which is interstitial cystitis, which is a bladder condition. She said there could be damage to the bladder, but it's very rare, but that doesn't mean it doesn't happen, right? So if there is, depending on the damage, they can repair it right then and there, or again, like if they find more endometriosis, depending on how much they find, if they find, where they find, it would be another laparoscopy surgery. So there's obviously a lot of risks, but that's just surgery. Surgery in itself is a lot of risks. But I wanted to kind of give you guys like an update. We are 10 days out. I am 10 days out. They asked if I wanted to stay the night in the hospital. I had already been told that I had to, so I kind of already got into the mindset of I'm staying the night, so we've prepared ourselves for that, which is fine. I told her anyway, you know what, I've already been told I was going to have to by a different doctor, by my primary doctor, which is fine. And I decided, yeah, I'm going to stick with that and stay the night, because this is the first major surgery I've had since I broke my nose. You know, I've cracked my head open, I broke my collarbone, all that, but my nose was the most major of surgeries I've ever had. So since this is technically my second major surgery, if you don't count anesthesia and pulling teeth, I would rather be in a hospital. I would just rather, if something were to go wrong, knock on wood, if I'm in pain and it can't be controlled, I'd rather be there and have people who know what they're doing help me out. So yeah, 10 days post-op, and I'm excited, but I'm nervous. I'm just hoping it relieves the pain. I know with endometriosis there is no cure, PCOS there is no cure, and it sucks, right? But I also have seen a lot of videos where people got it, it was the best thing ever. People got it, it was the worst thing ever. It made the growth worse. I've had people tell me to do the full. I've had people tell me do a partial, do an ovary only, and it's like, you know, it just, with all my health issues, and I have several chronic inflammation illnesses, so they all feed off each other. We know how that is. That's wonderful. I just figured one and done would probably be better on my body. So obviously, like, do what you and your doctor think is best for you. My whole life I wanted kids. And as an adult, seeing how tough the world is to live in and navigate and afford, I'm fine if I don't have kids. I hope you guys have a great day, and I'll see you in the next video. Bye-bye.